Welcome to the Alex Salmond Show, where we examine whether the highly infectious Omicron variant of novel coronavirus is really proving a blessing in disguise. When South African scientists discovered the Omicron variant late last year, they quickly followed up with empirical and detailed clinical observations that the variant seemed mild in its impact compared with its Delta rival. However, it was only when their findings were confirmed by 2 studies in the UK that governments throughout the Western world started to discuss treating Omicron like the flu, of relaxing social restrictions despite soaring case numbers, and of living alongside the virus. So is Omicron providing the herd immunity that the patchy worldwide vaccination programme has failed to provide? Or is it a collective bout of wishful thinking, which could lay humanity open to further new and more deadly variants? Today, we ask 2 top doctors, Dr Angelique Coetzee in South Africa and Professor Hugh Montgomery in the UK, both with hands-on experience of COVID patients, for their view on whether Omicron is proving a blessing or a curse. But first, to your tweets, emails and messages in response to our special show last week, celebrating Scotland's national bard, Robert Burns. First from Indie Boy, who says, really enjoyed this episode, and while I always knew Rabbi Burns was recognised and celebrated worldwide, I underestimated it when I listened to Billy Kay's history of Rabbi Burns and was fascinating. And then John says, in reference to that famous poem Tam O'Shanter, I only found out recently that Cutty Sark was the name of the witch. Thought it was the horse. John. Shirley says, I don't think there's been a programme on Burns covering the man and his global influence in such depth and with such varied content. Congratulations to all on the show. And finally, Louise Hogg, in relation to Alex and not me, says, you're looking very smart today. No less than the average haggis would expect, of course, if being addressed. Now, Dr Angelique Coetzee shot to international prominence when in mid-November last year, she alerted her country's authorities that in her GP practice in Pretoria, she was detecting patients with unusual COVID-19 symptoms. Quickly, South African scientists identified the new Omicron variant and reported it to the World Health Organization on the 24th of November. Alex speaks to Dr Coetzee from her busy surgery in Pretoria.
And it's my great pleasure to be joined by Dr Angelique Coetzee from her surgery in Pretoria in South Africa. Dr Coetzee, welcome to the Alex Salmond Show.
Thank you so much. It's a big honour for me to be on your show, and I really appreciate it.
Now, what was it like to become, at the end of last year, the doctor who discovered the Omicron variant and be propelled to international celebrity? What was that like?
It's terrible. I didn't discover the Omicron. I discovered, or I merely saw the clinical symptoms, and I reported on the clinical symptoms, and the scientists with their sequencing discovered that it is indeed a new variant and not the Delta, with all these new symptoms that I saw on that specific day. And because I'm part of the Ministerial Advisory Committee on Vaccines, I also alerted them halfway through that specific day, that Thursday, and I said, listen, something strange is happening. I'm seeing clinical picture of patients with positive Delta, PCR testing and rapid test at that stage. Doesn't fit any pattern. It's not Delta, definitely not, and it's not Beta. And that's how it started.
Well, you're very modest, Dr Coetzee, but nonetheless, it was a eureka moment. So, Dr Coetzee, how many patients were we talking about that you identified as suffering from this new variant towards the end of last year?
With the new variant, 120 patients. Up until about 2 to 3 days ago, we're still testing on a daily basis, patients coming in with upper respiratory tract infections. But there's not really any positive cases anymore. So I think within the next week or 2, we would be down to less than 5% and out of the 4th wave.
So in other words, as far as your experience in Pretoria was concerned, Omicron was a variant that swept through the population because of its infectivity, but it was up like a rocket and then down like the stick because presumably the population were gathering an immunity as a result of the infection. Would that be your analysis?
That's a difficult one. I know the scientist is not going to agree with me, but I think it's the nature of the virus. I think this is it's like a hit and a run. You know, a very high infectivity rate. It is a very, very steep incline. And then just as quickly as it came, it went away.
Do you have a theory or something from your practical experience which would give you a clue as to where the Omicron variant has been? Because it seems to have come down a different line of development from the original Wuhan virus than, for example, the Delta variant. So has it been developed in a patient with a compromised immune system, or has it been resting elsewhere, unidentified, or even has it been in the animal kingdom? Have you got any feel as to where you think Omicron came from?
It comes from the Netherlands. We were lucky to pick it up clinically in South Africa and on sequencing. But I think, yes, most probably it will mutate in a person with compromised immune systems, because their immune system would not be able to detect the virus that easily. And this is exactly the type of person the virus needs to mutate at its leisure. So I think that's very important.
Now, more than a decade ago, when I was First Minister of Scotland, I had an experience rather like yours, when the swine flu almost pandemic of that time, where because we had an identified number of affected patients, we were probably the first country in the world, in Scotland, to be able to say with some reasonable certainty this is a hyper-infectious virus, but it doesn't seem to have a severe impact on most people. That was similar, was it, to your experience with Omicron? Because at a very early stage, while the rest of the world were still saying, well, goodness, this could be doomsday, you were able to say, look, the evidence we have from Pretoria is, yes, it's very infectious, but also it's rather milder than some of the other variants.
The clinical experience, and remember, if you have been through the Delta wave, Delta is a scary, scary, scary variant. I never, ever want to see that again in my life. And if you then saw the clinical picture of those patients and you look at the clinical picture of Omicron, it's like chalk and cheese. It's different, total different picture. And it's much more like a top of a flu or a cold, without temperature, without oxygen need. So it is really not the same than Delta. And there was a lot of pressure on me to say it's not a mild disease. But if you look at the definition of the World Health Organization, what is a mild disease in terms of COVID-19, then it fits the criteria.
From a South African point of view, where are you now with the level of vaccination, and what more do you think can be done in terms of the health provision in South Africa to protect the population more?
We have low vaccination numbers if you look at it in the face of Europe. But you know what? We just need to keep on motivating our patients to go and get themselves vaccinated.
And is the difficulty in South Africa the motivation of the people to be vaccinated, or is it the logistics of vaccination supply?
It is the logistics, and it is the people that's not always that happy to go and get themselves vaccinated. I think it's a schlep for a lot of people.
If South Africa, which has perhaps the most developed health service in the whole of the African continent, has been encountering these difficulties, what message could you give to the international community about vaccinating the humanity as opposed to just bits of it?
So what we need to do is we need to get another form of vaccines. The storage requirements of these vials are not conducive for Africa. It's very difficult. It's long distances that it needs to travel. It's lots of logistics, lots of HR problems around it. They need to start looking at the pill form, the tablet form.
And in terms of the development of what's called a whole virus vaccine, that is a vaccine that both is it doesn't have to be stored in quite the conditions of the current ones, but also is effective against the whole virus. Where do you think we are in terms of medical breakthroughs in science, in terms of getting to a vaccine which will defend against the virus as a whole, as opposed to just certain variants?
Well, hopefully within the next year that will start to happen. The science is quite advanced, so let's see what happens. Let's watch the space.
And finally, Dr. Coetzee, in terms of your experience, you're modest in terms of your identification of the variant, but you've got your own substantial Wikipedia page now. I'm interested in you personally, what that last 2 months has meant from being obviously a distinguished physician in Pretoria, but into an international celebrity and expert on the variants of this virus. What has that meant to you personally? I mean, that's almost a different world, is it?
Yeah, luckily, I am very active in the healthcare sector, and so for me, I'm very much outcomes-based, and I have noticed already in the last few years that there's a move away from practical clinical medicine to more impersonal medicine, where you treat a patient over a health platform, which is not acceptable to me. You cannot treat a new patient like that. You cannot palpate an abdomen. You cannot pick up grooves. We do it the wrong way. We are moving away from good old medicine to more technical environment, which I don't think it's going to be conducive going forward for the majority of patients. We will see a lot of problems going forward because the human element is not there.
And Dr. Coetzee, are you being contacted by general practitioners around the world who are saying, good on you, Angelique, that you've a demonstration of what hands-on practical care of patients can tell us about the threats from viruses and assist in our understanding. Are you being the recipient of lots of emails from fellow GPs around the planet saying, good on you?
Yes, I have got it, and I've got hate mail as well. So, but I don't. I'm too old for that. I know what I just deleted. That I know. I know how to do that.
Well, I can tell you, Dr. Coetzee, you've had one very strong admirer from Scotland in myself, and I know the viewers of the Alex Salmond Show will appreciate your wisdom. And thank you so much for joining me on the show.
Thank you so much.
Join us after the break, where we'll examine the impact of Omicron in the intensive care wards of the UK with Professor Hugh Montgomery of University College London. We'll see you then. Welcome back. The highly infectious Omicron variant of novel coronavirus is ripping through Western societies. But is it proving to be a blessing in disguise? Professor Hugh Montgomery is both an outstanding academic and practising in the intensive care wards of London. Alex discusses with him the impact of Omicron.
Professor Hugh Montgomery, brilliant academic, but also hands-on consultant in the busy intensive care wards of London. So what has been the situation over these last 2 Omicron months in the intensive care wards?
Well, it's been interesting. As you'll be well aware, Omicron is very, very highly transmissible, very highly transmissible. It had a really big competitive advantage over lots of other viruses and the other COVID variants. But it wasn't as severe as it turned out. And we also had a large number of people who were vaccinated, which really helped. So the numbers hitting our intensive care units for mechanical ventilation were nowhere near those that we saw in the first and second waves. The really big challenge that all hospitals faced was the fact that, of course, the Omicron variant still made people sick. It still meant that they had to be at home to isolate. They were often laid up in bed feeling lousy for days, sometimes with long COVID, which we can talk about in a minute. But it took them away from hospitals where they would be working, for instance. It also meant if their family members or children were sick, they had to be involved in childcare. And the epidemic did sweep through. You'll remember that in some areas it was 1 in 10, 1 in 15, 1 in 20 people infected. And that was a really perfect storm. Certainly in London during December, it was absolutely savage. Huge numbers of doctors and nurses off sick, huge numbers of ambulance crew off sick, ambulance waiting times very substantial to get to patients. And then the ambulances couldn't offload into the hospital because there weren't the doctors and nurses to receive the patients in. And the system got very badly corked up. So I had personally probably the most sleep-deprived run I've ever had in my consultant career, beating even waves 1 and 2 in December because of those sorts of issues. It was large numbers of sick people, large number of people going off sick, and of course the usual winter surge that was there, that we get every year of other viruses, heart attacks, chest infections, etc.
So is that intense pressure beginning to ease now? At least the Omicron, in its acute impact on people, seems to be markedly, demonstrably less potent than previous variants.
Yes, that acute impact is less. We are seeing the numbers beginning to decline in hospitals and plateau off. Many hospitals had flipped their units, i.e. the major areas had become COVID and they'd restricted the numbers of non-COVID, have been tending to flip back, certainly in the London situation. And we seem to be through the really big hit where it swept through staff very readily. There's still plenty of people off sick with it, but nowhere near what we had in December. So things are calming down. But of course, you know me, Alex, we've spoken before. I'm not an alarmist, but I'm also not complacent. This is still a disease that lots of people haven't had. It does look as if there may be a signal that longevity of the immune response isn't quite so good, so that it's more easy to get a version again more quickly. And some people do still get very ill with this, particularly people with suppressed immune systems can become very poorly with this. There's good reasons for everyone to be vaccinated and not to pass this to other people. And personally, a large number of people, it's still a significant proportion, get symptoms that go on a lot longer than just a week or so of feeling flu-y. You'll know people, we all know people who are still saying, I'm still breathless 2 months later, I've still got a cough. Or a friend of mine talking to me this morning about a daughter who's a national standard swimmer saying she's 3 months out and still can't perform properly. These are not minor issues, and I personally would rather not have them. So I think the same sort of principles which you and I have spoken about a long time before remain. Without destroying one's life, meeting people outdoors in well-ventilated areas, wearing masks where one can on public transport and so forth. All of these things just make sense, and they don't tend to ruin your life if you can do them most of the time, I think.
So do you as a physician, having seen the impact of COVID on so many patients, do you detect among politicians, not just in the UK, but Denmark has relaxed all social restrictions this week, do you detect almost a complacency creeping in, that it's all over bar the shouting with COVID?
Well, I do, and of course, it could be right. I was wrong with the Omicron variant when it first started appearing before we had the South African data that might be milder. When I saw its infectivity, I thought this could be very bad. And I'd always rather prepare for the worst and be pleasantly surprised than be caught on the hop. Now, the trouble is there is a general narrative, isn't there, in the press and elsewhere and in the body politic, that we're now going from this pandemic phase where you get these waves of infection sweeping around the world, that we're now into an endemic phase. In other words, the virus is just embedded in society. It's going to grumble along at a low level, and they'll have the occasional swing upwards and downwards in the winter months, as we do with flu. And that combines with another narrative that viruses get more infectious but less severe, and this virus will, as a part of its natural course, end up being a bit like the common cold. Now, that's speculation. It can do. It may well be more likely to do that in the longer term, but we absolutely cannot be confident that that's going to be the case right now. It could be that we end up with a very, very much nastier variant cropping up than we've got at the moment. We just don't know. And I'm not a Puritan. I'm not suggesting we've all got to live as monks for the rest of our lives. But I do think we've got to be a little bit cautious now about the way we manage the future.
And what is this BA2 variant of Omicron that we're now hearing about in the UK?
Well, this is, I mean, I've not seen the sequence. I'm sure the sequence is there. I've not looked it up yet, but it's just yet another variant, this time of the Omicron variant. It's a new variant of Omicron, which seems to have, again, a slightly greater competitive advantage in terms of infection. So if we look at the genetic signature of Omicron that we're getting from patients, what we're seeing is an increase in that, outcompeting the original Omicron, just as the way that Omicron totally swept the Delta variant aside. The good news is we're not at the moment seeing any signal that this is in any way more severe as an illness. But again, the caveats go with all of that. Thank heavens, an awful lot of that is because the vulnerable, the people who would suffer most from an Omicron or a COVID infection, are well vaccinated. Huge numbers of people in Great Britain from 12 years old upwards are vaccinated. And I'd like to thank all of those people that have had their vaccines and their triple vaccines, because they are preventing these things spreading, as I say, potentially turning into nasty variants and potentially making other people sick. So it's a good news story for vaccination, even so.
Now, Professor Montgomery, on the show we've been speaking to Dr Angelique Coetzee, the Pretorian, the South African GP, who identified patients with what turned out to be the Omicron variant. She was slightly frustrated that that practical knowledge built up in South Africa hadn't managed to transfer the information as easily as she'd hoped to other countries, despite her best efforts in broadcasting. Are we in a situation where people doing the practical work of treating COVID patients pass on to their colleagues internationally their experience, for example, with the Omicron variant?
It's a very, very good point, actually. And it's something I've learned from this process too, because, of course, when we got wave one, we had no idea what this virus was like or what it was doing. Pretty much everything was hearsay. Remember, the first few cases were cropping up really in China in mid-January. We weren't really getting too much of a signal from what was going on there. Then Italy got hit, and then it was us. We very quickly learned we had to talk to each other. My very first Friday night on call, where we got absolutely sledgehammered, I was on the phone to friends that next day going, what are you seeing? Does it look like this for you? Are you seeing this as well? What are you doing for that? Are you finding this works as well? Or are you finding this is harmful too? The very next week, we expanded those knowledge shares, as we called them nationally, had the calls in, and then disseminated the information verbally and on social media. But we also moved them internationally. So we had calls within that first week with Italy, Germany, France, Spain, United Kingdom, but also China, Iran, and many other countries around the world. And it was incredibly useful. We kept those up, actually, during wave one and wave two. And then I guess took our eye off the ball a little bit and thought, well, we seem to have got this one cracked. And now our politicians and departments can do most of the heavy lifting and communicating. Now we're not on the back foot, and tell us what's going on. But actually, I have learned from this that maybe the thing I should have done when Omicron appeared was to call up my colleagues in South Africa. I've got plenty of friends who work there, and said, can we just all get on a call every day or two and just triangulate what we're actually seeing? Because it's often from those direct conversations you can tease the signal out. And from that, I've learned to pick the phone up again next time. I'll just try to keep those channels of communication open. I think it helps to be operating at all levels, political and policy, but also as practitioner.
Finally, Hugh Montgomery, at this stage in the pandemic, what's your greatest hope and what's your worst fear about the development of this virus?
Well, it's an interesting one. I've got, again, I'm not an alarmist. I'm hoping that my greatest hopes play out. I hope that people continue to maintain their vaccination status. So my hope is that people will continue to do that. My fears are that we might end up with abandon, people just going, well, I don't need these vaccines anymore. That's all gone. The new variants are all mild. I don't care. And I'm not going to worry about it anymore. You know, it's end of term. All the work's gone. We can now party like it's 1999 for the next year or two, and it'll be fine. I think that might work out, but it would be a big gamble. My other concern is that we end up with a nastier mutation appearing. And then, of course, my looking at the back of my mind is what comes next, because we've discussed this before, but in the last century, we probably only had 3 spillover events, as they're known, from animals to humans. This last 21 years, we've had 17. We've had SARS-CoV-1, SARS-CoV-2, we've had MERS, we've had strep suis, the bacteria, we've had Zika from rhesus monkeys. We've had an endless train of these because of the way we're treating our planet in terms of deforestation, for instance, forcing predators and prey together, which wouldn't normally ever see each other, wet meat markets and live meat markets, putting animals with feces, fur and feathers together, which shouldn't be seen either, and then having these crazy international use of airlines where we had nearly 150 people a second boarding an aeroplane in the days before COVID. So these viruses get spread around very quickly indeed. And as the old saying goes, if you always do what you've always done, you always get what you've always got. And if we've had 17 spillover events in recent years, we will have more. Bill Gates warned about this one coming. He was right. And we will have others if we continue to behave as we've done before. And it'd be hubris for us to do that. We need to stop doing it because the next thing that hits us might be one hell of a lot worse than this one is.
Professor Hugh Montgomery, with these sombre words, thank you so much for joining me once again on the Alex Salmond Show.
Thank you very much for having me, Alex.
Pandemics are scary, and new hyper-infectious viral variants really scary. Thus, it was understandable that many countries would react cautiously to the emergence of the Omicron variant in December by moving to tighten their social measures against spread of the virus. Given the infectious nature of Omicron, this has not stopped the new variant sweeping through country after country. From an early stage, South Africa provided empirically based information suggesting that Omicron, although much more infectious, was significantly less potent. As this information was confirmed by Western studies, official policy has gone into reverse in many countries, with restrictions relaxed and much talk now of living alongside the virus. Natural selection dictates that viral strains tend to become more infectious. The more infectious the variant, the more successful it becomes in competing with other strains. But there is no such absolute determination that these variants are in themselves less potent. The longer the virus survives in significant numbers, the more opportunity there is for such a nightmare scenario to emerge. So far, so good. Although that still means deaths running at 300 per day in the UK and 10,000 a day worldwide. However, the real problem is this. The extent of Omicron spread added to the vaccination programme will confer some protection. However, it seems far too early to be putting the bunting out and taking the face masks off. But for now, from Alex, myself and all at the show, it's goodbye, stay safe, and we hope to see you all again next week.